Hey guys, this is Dr. Jean-Guy here, and today I would like to talk to you about a very important topic, something that people have been, deals with on a regular basis. Unfortunately, they think that it's normal. It's common, but it's not normal. And the subject today is headaches. And how common is that? Just about 50% of the population at some point or another will be suffering from headaches. And there's a lot of different types of headaches. People can have migraine headaches. People can have tension headaches. People can have cluster headaches. People can have some ocular migraines, right? So there's a lot of different types. They come in different variety. And what I like to discuss, this is really dear to me, is when people have health problem. Me being a health and wellness doctor, being a chiropractor, being in practice now for 25 years, the question I always ask is like, what's causing the problem? You want to find out what's causing it. On the medical side, the approach is when people have headaches, is we want to be treating your headaches by giving you some medication, whether it's, Excedrin or whatever those medications are out there that are addressing, that are just trying to work on those symptoms. And, just for you to think here for a moment, does headaches, or the cause of headaches is because you don't have enough Excedrin in your brain? And obviously, right, the answer is no. I want to find out what's causing it. Do you have headaches because you don't have enough aspirin in your brain? Obviously, the answer is no. Want to find out what's causing it, right? Is it lifestyle? Is it stress? Is it, things that you eat? Is it, what's the trigger? Want to find that out. And oftentimes, what I've noticed now for, being in practice for that long, is I find out that when people have injuries to their spine that haven't been corrected or fully corrected, it is a huge contributing factor. I can tell you that in all cases since I've been in practice, that there's like having problems with your spine and nervous system is a contributing factor 100% of the time for people that have headaches. Because what happened is, in your spine and nervous system, those joints in the upper neck in your upper neck have everything to do, right, with causing some issues with, people having some tightness in that area, because if there's any kind of pressure on those nerves in the upper cervical area, the top two bones in your neck, because of prior spinal injuries that you've had that haven't been corrected or fully corrected, then you start developing, right? You start developing some glue-like substance into your joints, meaning they're not moving properly. And when you start having scar tissue, it's causing, here's a big term, it's causing disafferentation of the joints. And what that means in plain English, those bones are not moving properly. And when they're not, and it's irritating those nerves, then people will start having some of those headaches, or migraine headaches, or cluster headaches, or, any kind of those that you might have had experience, right, over the years, and thinking they're like, hey, that's just normal. My mother had it, and my sister has it, and it must be normal. And I always tell people, and I want you to listen to me, headaches might be common, but they're not normal. It's not unusual. I do a consultation, people will say, Dr. Jean-Guy, I have like just normal headaches, no big deal. And I'm like, normal means you have none. And if this is you out there, and it's like has taken over your life, that you have to be in a room with no lights, and you can't function, or maybe you can't play with your kids, or maybe you can't be the best mother, or you can be the best that you can be at work because of those headaches are interfering with your life, right? I say to you is like, hey, let's give it let's look at a solution for it, find out what the cause is, number one, and then how we can correct that, and how we can improve. Usually there's a component of the lifestyle that needs to be improved. But if you've had prior spinal injuries that haven't been corrected or fully corrected, this still is there. And it needs to be addressed to have full resolution of it, right? So you can break free, and you can have the life, right, that you're supposed to, have, and so you can fulfill the calling that you have on your life. So you can be maybe a better mom or a better dad, or you can function better at work. You can be more productive, or maybe you like to play sports, but you don't feel like you can do it because when you get home, you just have to exit the premise, and you're like, I'm checking out. I'm just pooped out. So if this is you out there, I just want to, number one, I just want to give you some hope that there must be a cause, and you got to find out the person that's going to be helping you out, and you should consider to check us out and to schedule your appointment and to have your evaluation for those headaches. So If this is you out there and you're ready to take action, just give us a call at 517-336-8880. 517-336-8880. We're looking forward to do this assessment on you and find a solution for the problems you have. Take care.